Radio Garden, and just type in RJFM for online box radio. For DZRJ 810 AM, just type in DZRJ 810 AM on TuneIn Radio, Streama, and Radio Garden. Happy listening! You are watching the multi-awarded Radio Bandido TV on Channel 224 Sky Cable and TV Plus boxes. Simulcast on DZRJ 810 AM. Informing, advising, and entertaining the Filipinos and OFWs around the world. Streaming live on www.facebook.com/DZRJ 810 AM or on YouTube, channel RJAM News. To all Teleradio Bandido viewers and listeners, you can now watch Teleradio Bandido on our new YouTube channel, RJAM News. Hit the subscribe button and like the video. Don't forget to click the bell icon so you get notified when a new video gets uploaded. Don't miss out on our dynamite lineup.
SOS, Serbisyo, Ora-Mismo, Sigurado. Programang tatalakay sa kapangyarihan ng serbisyo sibil. SOS, Serbisyo, Ora-Mismo, Sigurado. Programang hihimay sa kapangyarihan ng pamalang lokal. SOS, Serbisyo, Ora-Mismo, Sigurado. Programang maglalapit sa pamalan at mamamayan. SOS, Serbisyo, Ora-Mismo, Sigurado. Kikilos ang barangay para sa bayan. Edukasyon, kalusugan, trapiko, basura at iba pa. SOS, Serbisyo, Ora-Mismo, Sigurado. Tatalakay sa mga problemang napapanahon, problemang hahanapan ng solusyon. At ngayon, ang inyong mga lingkod, De Leon Gomez. SOS, Serbisyo, Ora-Mismo, Sigurado. This program is supported by the National Kidney and Transplant Institute, the Philippine Red Cross, Parenting Foundation, and the Metro Manila Council.
Magandang hapon sa inyo lahat. Today is Friday. Today is Forget Day. A message I received from a former colleague from DSWD where I spent 28 years of my work life. Forget who hurt you the past days, but don't forget those who love you every day. Forget the past that made you cry and focus on the present that makes you smile. Forget the pain, but never the lessons you learned. How true that today, with our special program in SOS, Serbisyo, Ora-Mismo, Sigurado, we have two stalwarts from PhilHealth. You will recall that last Wednesday, we had health and justice, and the discussion centered also on PhilHealth with universal health care. The good and the bad. Today, we are fortunate that we have our program content on PhilHealth. Why? Because we are unrelenting, unceasing, unwavering, and unflinching, and clearly unstoppable, the Red Cross way. And this is not just now, but in the days to come. Magandang hapon sa inyong lahat. At narito na may picture na yung actually dalawang panawin natin, si Delio Aceron na dati nang nagpunta dito, and of course ang anditong may picture na pakilala natin. Go ahead, introduce yourself na.
Yes, good afternoon Secretary Cora, at magandang hapon din po sa lahat po ng mga nakikinig ngayong araw to sa Serbisyo Ora-Mismo, SOS po sa DZRJ. Ako po si Raymond Acoba, mas kilalang Mon Acoba po. At I'm from the PhilHealth Regional Office of the National Capital Region. And I'm working here as the head of the public affairs office po in NCR. So magandang hapon po sa lahat ng mga taga-subaybay at nakikinig ngayong hapon na po.
Maraming salamat, ano? Kasi na-interview ka na namin, I think I don't know if it was a Monday or something.
Friday.
Friday din, ano? Pero alam mo, kaya kami lalong interesado kasi nga PhilHealth, your partner in health, very clear ang sabi dito. Pero alam mo, nag-face ang mga tao ng problems in relation to the universal health care. Kaya tamang-tama, this dialogue or this exchange is really to ferret out ano yung mga sistemang ginagawa nyo ngayon para matiyak na PhilHealth is really partner in health. No? Kasi na-mention ko that last Wednesday, we had interaction with Health and Justice at sinabi na yung hinahanap nila na mangyari sa PhilHealth. I don't know if Delio Aceron will join us. Makakarating ba siya? Si Delio?
I think hahabol po siya because he is coming from Manila tapos may flight siya kanina going to Cagayan de Oro po.
Okay. So,
pero hahabol po siya.
Yes, okay. Pero ang tanong kasi, nagse-certify ngayon ng PhilHealth ng mga ospital, correct? Certifying, kasi yun ang narinig ko kay
that's
accrediting.
Accreditation. Apa.
Accreditation. Meaning, pag doon ka nagpunta doon sa ospital na yun, ay makakatiya ka, natutulungan ka, or yung, yung benefits mo sa PhilHealth ay makakatanggap ka dahil legitimate yung ospital na pinuntahan mo. Am I correct in that understanding? Right now,
Secretary.
Right now, in Metro Manila, which you cover in NCR, I'm sure maraming ospital yan. Kasi ang kina-accredit nyo thus far ay mga private hospital. Yung bang government hospital, ina-accredit pa rin o hindi na? Anong situation?
Yes, Secretary Cora. We accredit both private and government hospitals in order to assure our members na quality healthcare service po ang binibigay sa ating mga member.
That is why I was in a way, I don't want to say defending, but explaining what PhilHealth is currently doing. In other words, it is an unfinished business. Kasi nagkaroon ng problema din ng PhilHealth sa ilang mga ospital and therefore you're trying, ang tawag ko doon, cleansing process, di ba? Parang tinitiyak nyo na yung mga ospital na yon are above board in their relationship with the patient kaya yung mga fee charging activities nila. At the moment, maybe you can tell about what is happening now in NCR. Kasi medyo malaki ang NCR so many cities, diba? And one municipality. So, kwentuhan mo kami ang status ngayon ng accreditation process. And how do you accredit? Siguro ikwento mo yung the accreditation process to begin with.
Yes, Secretary Cora, you are correct po that one of the biggest region in terms of operations kasi not only NCR po ang covered ng pro-NCR ng PhilHealth Regional Office ng NCR, but it also includes the whole province of Rizal, which composed of 14 municipalities and one city, yung Antipolo. So it is really challenging on our part here sa PhilHealth Regional Office NCR. So what do? We have to remember that the Universal Healthcare Law, hindi lang po ito PhilHealth, involved dito the other government agencies such as the Department of Social Welfare, of course the Department of Budget and Management, DBM, the Department of Finance, and importantly the local government units because and of course yung mga healthcare providers po natin such as the mga healthcare institutions. Okay, what is the importance of accreditation? So accreditation, we enter into a memorandum of agreement. So this is a contract between PhilHealth and the hospital that on the part of the hospital as an accredited institution, a healthcare provider of PhilHealth, they have a commitment to give the quality healthcare service to all PhilHealth members. Likewise, as much as possible, no, they will give all the help that they could give to our members, and they will also apply the policies and programs po of PhilHealth, such as the all case rates or benefit packages that the members could avail. So ito po yung importance ng being accredited institution. Okay, so doon po tayo sa current situation. As of nung December po, we extended, no, yung accreditation kasi we have to give them time, no, because of the situation. Marami rin tayong trabaho, tapos at the same time, because of the pandemic, binigyan natin up to January 31, no, of this year, 2022. In-extend po natin yung accreditation nila while they are still ongoing sa application po nila or in process pa yung application nila. Again, to follow that, no, again, we came out with another PhilHealth advisory, which again extended up to February 28 of 2022 to give more time to our to give more time to our healthcare providers to submit their accreditation requirements to PhilHealth. So with those advisories, ma'am, no, and here sa NCR, we are really talagang we are so giving all the leeways, no, to our healthcare partners and institutions as to the accreditation, no, of their hospitals. So inaayos talaga po natin yan. So let us discuss naman po, kasi ito po yung madalas na primary issue is the claims reimbursement, no. Starting, no, this year, January 5 and January 7 of this year, we conducted right away a dialogue with our healthcare providers here in NCR and Rizal. January 5, we call it coffee clutch, Secretary Cora, no? Because it's a coffee clutch because it's a virtual, casual conversation so that we can exchange ideas, exchange issues, and share our concerns and issues then, ano, with each other. So yun po yung tawag natin, coffee clutch. So January 5, that's on a Wednesday, we started with the government hospitals here in NCR and Rizal. So it was dedicated for the government hospitals. Then January 7, that's on a Friday, we engaged again with the private hospitals. So that we can discuss with them the current situation of their claims reimbursement. We explain to them the process, and we also explain to them why sometimes it takes time to process their reimbursement. Sometimes kasi it's kumbaga dapat magtulungan talaga kami because sometimes kulang po yung mga documents, kulang yung mga signatories. Opo. So you also came from the government, Secretary Cora. You know that we are bound with the rules of the Commission on Audit. That's why we have to make sure bring back the documents na dapat kumpleto po. Fully accomplished documents, complete, and at the same time properly signed, duly signed by the people, the doctors or the whoever are the authorized signatories in the hospital. That's what we call return to hospital na mga documents. It's not really a bad claim, it's a return to hospital kasi kulang lang po talaga yung mga documents na we are bound to follow kasi.
But the reality talaga, no, Mon, is the fact that it is the patient who is affected, no? Kasi the relationship is with the hospital, but it's the patient who cannot be discharged because hindi pa nagbabayad ng PhilHealth, or kung magbayad naman ng PhilHealth, nagbayad ng pasyente, which happened in one hospital, nagbayad ng yung claim ng yung part ng PhilHealth niya ng pasyente, hindi na makukolekta kasi para sa akin, mutan academic kasi namatay ng pasyente. But beyond that, ang nakita ko ngayon, status report. Kasi like we were speaking with the president of private hospitals, and of course he was quoting billions ang utang. That's a claim that needs to be, in other words, studied. Ano-anong ospital? And I think the status report will bear that out. Sino yung pending pa? Sino yung tapos na? Kasi when we last talked with Delio, you already mentioned which hospitals in Cagayan de Oro have met already the accreditation. Ang ganda sana if every week or every month, you will have a status, the following hospitals have already been accredited. This way, kung ako ay pasyente, hindi muna ako pupunta, hindi pala accredited to hospital na to. Baka hindi bayaran kung ako yung PhilHealth ko. Meron, pwedeng the patient will have a claim, will have the information that can warrant the claim or that will facilitate the claim. I see that as a possibility kasi I don't want to judge PhilHealth that they're not doing their work, but I do want PhilHealth to know that it is affecting not the hospital so much, because the hospital can wait not until they're black and blue, but can wait for PhilHealth because they know the PhilHealth will have the money to pay them. But what about the patient who's affected na delay yung kanilang discharge dahil hindi pa paid? Anong thoughts mo dito? Anong pwedeng magawa natin dito?
Yes, Secretary Cora, I could consult with our Healthcare Delivery Management Division.
Yes.
That division or that office handles the accreditation of our healthcare providers. So with their permission and with their authority, I will ask them to give me a status, to give me a report, the status of the accreditation of our hospitals here in National Capital Region and in the province of Rizal. And we could by next week I can read. We can read the names of the hospitals who are already accredited.
Then
so
that can be your news. That can be your news on your Friday, PhilHealth Friday. Kasi para sa akin, ang content is reporting. Actually, nakikinig ngayon si retired Commissioner Mary Ann Fernandez Mendoza, who of course is head of health justice. At sabi ko nga sa kanya, makinig ka because we will take it up with PhilHealth NCR. But we're also hopeful na PhilHealth Cagayan de Oro will also be able to join later. But ang importante sa akin, NCR kasi dito ang mas maraming ospital. And if you commit, if you will discuss that with your cohort there in PhilHealth na ina-ask kayo na to publish or to inform the public the following hospitals have met the accreditation standards. And that is a wow, that's a wow news dahil feeling ng mga pasyente ay okay na yung mga hospital and if they're in the hospital presently confined, that's really good news because pag discharge nila, ayos na. I saw that in one hospital when our house help had a baby. Ang ayos-ayos kasi nandun na yung lamesa ng PhilHealth doon sa private hospital na yon. Sabi ko nga, ang ganda-ganda. That was the first time I saw ng PhilHealth desk. May PhilHealth desk. It's not such a large hospital, but it's a local hospital in Makati, private hospital. So I was so impressed and I said, what if this is done all over the country na walang ka-worry-worry ang miyembro na magpapakonfine dahil alerted na ang PhilHealth at nandun may taong PhilHealth doon sa ospital. Are you able to maintain this? Marami bang ospital na meron ng PhilHealth na tao ngayon sa NCR? What's the situation?
Yes. Okay. We started this, Secretary Cora, year 2012.
Yes.
We call it PhilHealth CARES. And CARES stands for Customer Assistance Relations Empowerment Service.
Yes.
So that's CARES. And the PhilHealth CARES, we require them to be a registered nurse and they will be stationed in accredited hospitals all over the Philippines, no? Particularly sa amin on our part dito sa National Capital Region, so that they could assist our PhilHealth members as to
The
claims
claims.
or as to membership, or if they have any questions about PhilHealth, they can be approached. So we still have PhilHealth Care is still existing, and it really helped, no,
Who
our
pays? Who
members
pays
during
the
the time of
salary?
hospitalization.
Sino
The
nagbabayad ng
PhilHealth Cares
sweldo?
is that's under the corporation,
Hospital.
Philippine Health Insurance Corporation. That's
Okay, you're
under
paying.
PhilHealth.
Oo,
Opo.
oo.
That's why the only dilemma here, Secretary Cora, is we do not have enough budget to provide each PhilHealth
Hospital.
accredited hospital in NCR with one PhilHealth Cares.
Yes.
That's why what we did is we improvise, and what we did is per day, no, alternating days po sila per hospital, so that at least we can cover all hospitals in the National Capital Region.
Oo.
So our PhilHealth Cares are still ongoing.
Operating.
Tuloy-tuloy pa rin po sila. They're still operating po up to now. And again, dumadami po yung hospitals po natin, pero yung the number of our PhilHealth Cares hindi po dumadami. And we know that not all nurses naman can stay long here in PhilHealth because they have other plans pa, no, going abroad or working in
Pero
hospitals or practicing their
kailangan bang
profession.
nurse? Computation
Yes.
naman yun eh. Bakit
Yes,
kailangan nurse?
it was required
Because of
that
the law?
all of our PhilHealth Cares are registered nurses to, of course, to ano po, para to stand as of course, unang-una dapat professional po talaga yung ating mga PhilHealth Cares, and they are somehow aware because of the background, the educational background, and at the same time yung medical terms, they are aware of it as a registered nurse. So
But it is possible, I think, given the shortage, no, also of nurses, no. Ang nakikita ko dito, trained, in other words, nursing graduates na hindi naman nagpa-practice ng nursing, pero accredit, yung parang ang registered, parang sa amin kasi sa social welfare, meron kaming social welfare aides. Hindi sila professional social worker, but they do part of the work that the social worker will do, yung parang the data gathering, you know. I'm just saying that to address that problem, it will also give you an opportunity to hire more, but trained. In other words, train them on the nature of caring regarding. Kasi ang gusto mong hulihin dyan, yung mga nandadaya eh. Yung mga hindi totoo nilalagay doon sa claims. But they're there in that hospital, and therefore will actually connect with the office or with the hospital staff that will say, ay, hindi yan mga gamot na nagamit ng pasyente na yan. Bakit nakalagay dyan mga gamot na gano'n? I have a master's degree in public health, and I know na napaka-importante ng transparency sa ospital. Bakit ganito ang bill? And I saw that in private hospitals. Na you don't know whether yun ay nainom ng pasyente dahil namatay na yung pasyente eh. So, how do you check na yung mga pinainom na yun? So, I just find it important to really have very honest people in those cares program ninyo to make sure na hindi nadadaya ang PhilHealth at hindi na short-change ang pasyente. Diba?
Okay. Yeah, you're definitely correct, Secretary Cora. That is the reason also in our branch offices or in our regional offices, we have this unit called Benefit Administration Services. These Benefit Administration Services are composed of doctors. There are doctors because they are the ones who review the claims documents of the hospitals, and they validate, they verify, they review, they assess, and see to it that all the healthcare management that they have given to the patient, all the medicines that they have given to the patient, and sometimes they also require the itemized billing, statement of the coming from the hospital to make sure that na tama po, no, na proper care ang binigay, proper yung medicines, and of course to protect also from fraud.
Yes.
Mhm.
Kasi
So,
di ba, nag-fraud din kayo sa mga operation sa mata, sa mga na-issue na yun. But I will not dwell on that because
Okay.
we want to dwell on future. Ang nakikita ko lang dito is that kapag merong mga ospital na spurious ang mga dokumentong sinasabit, it requires really, hindi investigative journalism, but investigation on the part. Meron kayong grupo that will go and really study what went wrong. Kasi pwede ang tao, hindi naman ang ospital ang mali eh. Ang mali ay yung taong in charge sa that particular element kasi akala niya, sige tutulungan ko kayo, ilalagay natin dito, ganito yung mga claims nyo. Sige, pag natanggap nyo yung check nyo, huwag na akong kakalimutan. I just feel that may mga ganong conversations that should not be part of PhilHealth if you want to really be partner in health. Yun ang nakikita ko. And I have seen this, of course, as chairman of civil service, siyempre, very important yung ethical practice. No? So pag may nakita kayong unethical sa mga tao ninyo, also drop the bomb and say, this is not acceptable. And so therefore, PhilHealth will clear the decks na walang ganyang tao dapat sa amin sa PhilHealth. Yun ang tingin ko lang dito.
Yes, correct, Secretary Cora. Again, we have our legal team per office naman who visits hospitals once in a while. Random visit po yun in order to check po yung how do they avail of the PhilHealth benefits. And sometimes they also check the records of the hospitals. So yun po. Not only hospitals but also other healthcare facilities.
Clinics siguro. Basta mga nakiklaim.
And mga dialysis centers also.
Kasi yung mga doktor din nakiklaim, ang tagal namang magbayad ng ospital. Sasabihin kasi, hindi pa nakakabayad ng PhilHealth. Kasi parang chicken and egg problem na it's not fair also to PhilHealth because baka yung accounting service ng hospital na yon is not doing its work right. Unfair din sa mga doktor na sasabihin niya, ay, ang hirap ng well, of course, they also have to deal with yung private health system na listed sila as kasama sila sa different kinds of care. No? But moving on, ang nakita ko dito, and this is where you can help further na parang may hotline na pwedeng yung claim na hindi na ang tagal na alin ba dito at saka anong klase kasi ako talaga ang concern ko yung binayaran ng pasyenteng namatay yung kanyang PhilHealth kasi ayaw payagan ng ospital dahil hindi bayad ang PhilHealth. It happened and we don't want that to happen again. Dapat yung pasyente should not have paid the PhilHealth portion dahil hindi ang problema yung relationship ng hospital sa PhilHealth. What do you think of that? I mean, how will you comport that?
Okay. For that reason, Secretary Cora, we make sure talaga that all the documents submitted by the hospitals for their reimbursement will be double checked po by our claims processor. And our claims processor, kasama rin na, we have also doctors who work to double check and assess and verify po in administration section.
Kaya nga reality test. Sige,
ang reality, Secretary Cora, there are voluminous claims, reimbursement here in the National Capital Region and Rizal. And kung ibabangga nyo po sa number of personnel po namin, kulang po talaga.
Correct.
Yung number of personnel. That's why we are asking understanding and consideration. And at the same time, we are still awaiting because of the reorganization. Here
ang suggestion ko dyan, identify the people in the hospital who can be given maybe honorarium, hindi sweldo, no? Pero that way, they will be parang audit group, no? And it is not just one person kasi baka kailangan they can double check, no? Kasi baka isang tao lang eh. Uy, ang lakas-lakas niyan. Kung gusto mong maka-claim ka sa PhilHealth, pag tinignan niya, ayos na yan. Which should not be, because kailangan din naman tao ninyo ang nakakaalam at gagalaw dyan. Pero ako naniniwala na panahon na para we begin to trust new areas. In other words, yung although nursing ang kailangan nyo, somebody na parang tutulong, pero ang kailangan nyo, somebody who can really do accounting na maa-add kagad kasi kung mag-a-add, baka nurse hindi pa marunong mag-multiply. I mean, it becomes an impediment dahil hindi kaya, di ba?
Yes, actually, Secretary Cora, as to the benefit packages, no, that's the reason na ginawa po nating all case rate.
Yes.
Para fix na po, less arithmetic na or less calculation na. Opo, for example, if we talk about cesarean, CS po, that's 19,000 pesos. So, automatic po na ima-minus mo lang 19.
Yes, I saw that.
And 40% of that 19,000 will go as a payment as professional fee and
basta may rates kayo.
30% because that's a medical condition.
Yeah.
Pag medical
but
condition,
people don't know
po.
that. That's the point. Yung public information din na dapat ipapaliwanag dito sa pasyente na itong nangyayari dito. Ilang percent ang mapupunta sa ganon, sa ganon. Kasi to me, it's patient information also. That is necessary. Who will do that? You won't have the PhilHealth person going back. Kailangan there is, parang I don't want to say, parang may, hindi naman lahat magbabasa ng brochure, pero yung rights ninyo, karapatan ninyo, na habang na kayong nasa ospital, ito ang mga dapat alamin. And I think it's communication. And since that's around your alley, start to experiment on that. In some hospitals now, you find na hindi marunong mag-handle din ng kanilang mga area of influence. O baka, hindi mo sasabi, meron ding mga corrupt doon sa mga ospital na yun. I don't want to judge. Baka magalit mga ospital sa akin. Hindi ho. Kasi sabi, kasi side ho kayo ng PhilHealth. Hindi ako side ng PhilHealth. I'm just giving a voice to PhilHealth para maliwanagan. Kasi otherwise, people will think, nako, ang hirap-hirap. In fact, when hospitals tell me, nako, ang tagal-tagal magbayad ng PhilHealth. And when I also find that, kasama na rin ang Red Cross diyan kasi may relationship din sa PhilHealth ng Red Cross with the blood the PCR, yung mga testing, di ba? Pag members ng PhilHealth garantisadong libre, pero ayaw mo din naman tingnan ng ang Red Cross will also be party to some shenanigans. It is not acceptable. In fact, I say unstoppable ang Red Cross sa bagay na ito dahil our claim to fame is our kumbaga integrity is one of our fundamental principles. Pero going back to PhilHealth, as I said, palagi ko in-emphasize, this is your partner in health. Bakit? Unlike other countries na kailangan private sector palagi, kailangan meron ka bang, or although they have Medicare, Obamacare, may mga ano sila iba in other countries, but we need to capture, kasi iba at the barangay level, iba at the city level, yung kaalaman nila dapat matutukan, to use the word. And given this is why I feel that this Friday health, let us not forget that PhilHealth is Tuesday. Palagi kong memorize ko na yata, PhilHealth is your partner in health. Dahil kung hindi sa iisipin yan, people will think na, ay bakit ang tagal-tagal ba? Pag sinabi sa akin na ang tagal-tagal, wala pang hindi pa naaasikaso. Of course, I feel as former CSC chair, I don't want that. I don't want to hear that from anybody regarding an agency. Kaya I'm so happy, of course, that you're here and you're sharing your possibilities pa. At ano pa yung concern ninyo na hinaharapan ninyo? Kasi yung claims na you find na spurious, of course you should not pay. But those claiming must know that ito ang spurious na claims. Yun ang sa akin. Feedback must be made and made as soon as possible para alam ng mga tao bakit hindi nababayaran. Go ahead, Mon.
Yes, Sec Cora. One area that we also have to improve is, of course, is the giving proper information and knowledge to our members.
Yes.
What we have observed is the only time that they remember PhilHealth is once na one of their dependents or they themselves gets hospitalized. That's the only time.
I know that.
We have to remember that PhilHealth is an insurance. It's a preparation for any accident or indemnity or accident or illnesses. So as much as possible, if you have some time, please learn about PhilHealth somehow, no? At least yung mga basic needs lang.
Yeah.
And of course, for example lang po, yung updating of member data records. For example, nagpakasal na po kayo or you have a newborn child, please declare them right away as a dependent so that when the time comes, when your dependents will be hospitalized, they could avail of the PhilHealth benefits. That also goes with our senior citizens because under the universal healthcare, our senior citizens are also automatically covered by PhilHealth under the UHC and also the Public Act 10645 or the Senior Citizens Act, no? So all they have to do is one-time registration lang, then they will be a member of PhilHealth for the rest of their life. Yun po yun sa senior citizen program. And Sec Cora, you also know that the last time that we had reorganization was around September 2006.
Yes.
And we were studying the population of the Philippines. That was around that time we were only 80 million.
Yes.
Our population were only 80 million. And right now we're around 110 million.
Yes.
So, but the number of our personnel did not increase that significant, no? Compared with the number of the population. That's why as kami po sa operations, we really felt na dumami na rin talaga yung ating mga members, yung mga dependents dati, naging members na. That's why we're pushing also for the reorganization of PhilHealth para
But pwede nyong magamit yung barangay health workers na parang yung advocates ninyo. Kasi sila ang makakaalam kung sino ang dapat, anong mga dapat matutunan. Unless you mobilize the barangay approach sa delivery of services, talagang mahirapan kayo if you just deal with the hospitals. Dapat alam sino itong pasyente nito, saan barangay to. And I always feel na that information will help you. Saan yung coverage. Even I already have dalawa lang ang cards ko, senior citizen, at PhilHealth. Wala nga akong Comelec card, kaya hindi ako makakaboto. Pero kaya ko sinasabi ito, I will encourage all senior citizens to have that PhilHealth card. So in my barangay, I will tell my barangay chairman, sino pa dito sa barangay natin ang walang PhilHealth card na senior citizen. I will make that an advocacy of the barangay chairman and the barangay health workers in that area. Pag merong isang senior citizen diyan na walang PhilHealth card, kawawa pag nakasakit. Dahil ni walang record, walang so libre naman ito because the government pays for it. So yung total coverage for senior citizens at the community level will be really fantastic in the next administration. Makikita pwede yung i-march yan, parang marching order at the barangay health center na lahat ng senior citizen ay dapat makaregister para they will have a PhilHealth card.
Yeah. Actually, Secretary Cora, we have marketing officers for local health insurance offices. And our marketing officers, one of their functions is to coordinate with the local government units. And as to that area, yung senior citizen, we coordinate with the Office of the Senior Citizens
Yes.
Affairs so that we could get a list of
Data.
names of the senior citizens. In fact, with their permission, of course, if it's possible, they will be the ones who will accept or receive the PhilHealth member registration
Yes,
forms coming from the
application.
senior citizens.
Oo.
And they will collect that, they will gather that, and through their liaison officers, they will be the ones who will submit it to the PhilHealth local health insurance
Oo.
offices so that the senior citizens will be saved from going to our offices.
Yeah.
Instead of them going to the LIOS, they will just get their card. There's Office of the Senior
True.
Citizens Affairs office
Yeah.
in the local government unit
Oo.
where they are
Oo.
situated.
Since I live in Parañaque, I will try to model that
Mhm.
sa Parañaque, no, to make sure that, alam mo, sa Parañaque, we have 16 barangays. In all the barangays, lahat ng aming senior citizens, member na ngayon ng PhilHealth. Kasi libre naman yan. All they need is to be registered and to have a card, di ba? Pero sa totoo lang, ang iba naman, ang ibang problema is walang mag-asikaso kasi yung mga senior citizen, di nga makalis. Tama yung sinasabi mo. Kaya I'd like the barangay health system be in place to ensure na walang senior citizen, na walang PhilHealth card sa kanilang barangay. I think that's the best.
Yes. Kasi Secretary Cora, not only that, no, because we here at PhilHealth, we need one valid ID, no.
Yes.
Usually the senior citizen
ID.
card. So kung kukuha na po sila ng senior citizen card, meron na po sila, isabay na rin nila yung
Yes.
Opo, sabay na. Doon na po sa OSCA, para si OSCA na po ang magpapadala sa PhilHealth para isa lang ang pupuntahan ni senior citizen. Or baka nga pwede si barangay na po sila mag-submit, si barangay sasabit kay OSCA.
Kasi sa barangay, merong sa barangay council member na in charge of health. Kasi merong
sa senior citizens.
Senior citizen, yes, of course. Kaya makakatulong. Well, we only have a few minutes, pero siguro wala si to get questions, no? Pero siguro ikaw na magsabi kung ano yung napapansin mo na kailangan pang ulit-ulitin natin sa mga nanonood, nakikinig sa atin.
Yes, Secretary Cora, this is fresh pahuto. It came out yesterday.
Okay.
Kasi we have been wondering, no, because under the law, there's a progressive increase of our premium contribution. But because of the pandemic, because of the pandemic, actually it did not move, no. Kumbaga, it retained lang po siya. Noong 2020, it's 3%. Supposedly, 2021, it should be 3.5%. That's under the law, no? Tapos sa 2022, it should be 4%. Okay?
So you're behind.
Yeah. Pero nung 2021, by order of our government, President, niretain lang po at 3%. Yung 2021. But yesterday, a memo coming from the Executive Secretary or sa Malacanang po, naglabas na po sila ng decision that there should be an implementation of the 4% contribution rate and salary cap for the year 2022 in accordance with the schedule provided in Section 19 of Republic Act number 11-22-3 or otherwise known as Universal Healthcare Law. So what are the changes? First, this year, starting January, effective January 2022, so 24% na po per month of their monthly income ang magiging premium contribution.
Ang isang,
tapos yung income,
sige,
yung income
ang monthly income, halimbawa katulong, no? May monthly income siya. Ako, ang feeling ko, I can absorb the requirement nga na monthly kung magkano man yun. Dahil I stand to gain kapag hindi magkasakit yung ano na yun. I stand to gain pag magkasakit dahil merong membership. Pero of course, not all employers are like that. Kaya depende sa... But a case in point is my own maid who after giving birth, has stopped paying PhilHealth. So sabi ko, upgrade mo. Kasi paano kung magkasakit ang anak mo? Sabi ko, kambal pa naman. So ngayon, that is something I will do. I will ask her to go to PhilHealth and catch up. Yung bang dating mga utang ng dapasa, babayaran pa o magsisimula na lang start-up na naman parang sa SSS? Anong mangyayari dyan? Parang hindi siya nag-up-to-date Oo, anong pwedeng mangyari dyan?
Doon po sa ito po nakalagay sa batas, section 9, missed contributions should be paid by the member so that they could avail of the PhilHealth
benefits.
So in other words, so kung may gap po sila, kailangan pong ma-fill out yun o mabayaran. Pero ang reckoning point po natin would be the effectivity of the law, which is November 2019.
Okay.
So yung prior November 2019, okay na po 'yun. Walang requirement hiningi.
So November 2019
onward, 2019, November 2019. Of the year 2019 onwards, kung meron siyang mga bungi or mga gap contributions, that's the time na kailangan niyang bayaran yun.
3 years to kasi hindi nagbayad. Kasi 5 years na yung bata ngayon So that means prior to 2019, di ba? So ang babayaran lang ng 2019.
November 2019 onwards.
Yes, oo. Kasi pinanganak pinanganak ng 5 years old na yung mga ang kambal So, kino-compute ko. Kasi gusto kong matulungan. Sabi ko, I did not even know that she was not paying any more PhilHealth. Kasi nag-benefit. Tuwa nga, nag-benefit ng mga anak ng kambal Sabi ko, kita mo na. Kasi iba yung na up-to-date ng membership. And I want that as a showcase to tell the people na masasaktan kayo kapag hindi nyo na-update and then it is too late. Kung kailan nyo kailangan ma-hospitalan ng anak, hindi na pwede dahil hindi kayo bayad. So, I solved one problem. Kailangan lang bayaran yung 2019. Kasi that's the only time, 2019 to 2021. Diba?
Yes.
Oo. Kailangan bayaran na. Must pay.
If not immediate naman, they could pay it naman staggeredly.
Oo. Okay lang naman. Kasi monthly
okay lang po yun.
Magkano ba yung monthly ngayon? Magkano yung monthly ngayon?
Ayun po, naging 4% na po kasi tayo this year.
Which is how much?
4%. So, meron po kasi tayong salary range. So, yung income floor is still 10,000 pesos. The income ceiling po tumaas from 60,000 naging 80,000.
Okay.
So, for example, if one person is the monthly income is 10,000 pesos, you multiply that by 4%, that's 400 pesos a month. Pero, halimbawa naman na kumikita siya 80,000 pesos or above, ceiling natin is 80,000. So, 4 times 8, that's 2,000, 4 times 8, I mean, that's 3,200 a month po.
Ay, ang laki. So, palagay ko yung 400, reasonable na yung 400. Kasi pwede din naman shared di ba? Pwedeng employer will share. 20, tayo, 200 tayo. Para that way, kasi na-increase ang sweldo mo, tsaka yung mga maghanap buhay ka naman ng konti, dagdag para makatipid tayo. Anything else update? Sige.
So, yan po yung isang update natin na this year, 2022, yung ating premium rate is already
4%.
At 4%.
Okay.
And the income ceiling was raised from 60,000 to 80,000 pesos.
Per annum.
Per month po yan.
Per month. Meron I was referring kasi to a helper. You're talking about an employee and okay naman.
Employee. Employee.
Okay.
Ang next po, we also want to inform the public that the PhilHealth member card and the PhilHealth member data record, they are given issued for no fee. Wala pong fee yan.
Walang bayad.
What you pay sa PhilHealth is the contribution. Pero as to the amendment or the member data record or the card, yung issuance, wala pong bayad yan.
Okay.
Kasama po yan sa service ng PhilHealth. Because what's happening right now, Secretary Cora, we have been receiving a lot of reports that there are certain people, no, who take advantage na they will take care of your PhilHealth card, they will register you as a member, they will give you the MDR for a fee. For a fee.
Pero alam mo, sometimes I think na merong mga ganon. I know somebody na retired na siya. Tapos sabi niya, ma'am, pag merong kailangan humingi ng tulong na sa GSIS, pwede akong makatulong. Parang alam ko yung pasikot-sikot. To me, I don't mind that. If he is known to the community at parang volunteer, bibigyan mo na lang siya ng pamasahe to follow up. Kasi yung senior citizen, di naman makalabas eh. I'm looking for that. To me, that's a volunteer. That's volunteering for human services na hindi na magawa ng taong miyembro. Like you can have members na senior citizen. Kung makakatulong na ma-register siya sa barangay, eh ano ba naman yung bigyan mo ng pamasahe? To me, there's nothing wrong with that. Ang importante, hindi naman nanloloko. Ang importante eh, dalawang ginagawa yung kanyang tungkulin for the benefit of the community, for the benefit of the members. So ano pa yung ang challenges pa ninyo sa PhilHealth bukod sa meeting the needs of go ahead.
Right now kasi under the Universal Healthcare Law, meron po isang nakalagay dyan na kailangan kasi PhilHealth mas alam na curative measures the only time they could avail of PhilHealth benefits is when the
hospital
member or has been admitted or confined for at least 24 hours. Okay. Right now, we are also opening up na sa preventive measures kasi may kasabihan, Secretary Cora, that an ounce of prevention is better than a pound of cure. So we are looking into that and we are introducing already the consulta package.
Consultation.
Consulta package. Consulta package. Sulit at tama. Yun po yung gusto natin, no? Consulta package, sulit at tama. So ito po yung mga primary care benefit packages po natin. But we can only push through with this kung kasama natin ang mga lokal na pamahalaan, yung local government unit, because we will be utilizing their health centers as a consulta healthcare provider. Of course, we have to accredit their healthcare provider, yung health centers, para maging consulta healthcare package siya. And once na maging consulta healthcare package po siya, maging consulta healthcare provider siya, that would be the time that we can give yung health center po as the provider. So accredited na po siya as a healthcare provider. May bibigay na natin ngayon yung mga benepisyo under the consulta. So what are those benefits? First, services, meron pong medical consultation, no, na mapupunta yung mga constituents, so yung mga tao doon as a clustered area.
Libre.
Of course, libre po yan kasi meron pong pondo makukuha mula po sa PhilHealth. Pangalawa po, kasi ang layunin nga po ng konsulta is to maintain the health condition of the members. So as much as possible, we have to check their laboratory tests. May mga lab works tayo. So what are those lab works? CBC, incomplete blood count with platelet count, urinalysis, fecalysis, sputum microscopy, fecal occult blood, pap smear, fasting blood sugar, oral glucose tolerance test, ECG, chest x-ray, and creatinine. All of those laboratory works or lab works, no, can be provided by the consulta package. And lastly,
pero kailangan available yun dun sa agency kasi lalagay mo dyan tapos wala namang hindi available doon. They will have to go elsewhere. Yun ang nangyari.
That's why Secretary Cora, that we have to accredit the healthcare provider that they could provide all the services as mentioned under the consulta package. So lastly po, yung medicines also, we can give them free medicines such as fluid and electrolytes, anti-asthma, anti-diabetic, anti-hypertensive, anti-thrombotic.
Pero hindi gamot ang bibigay, pera.
No, medicines po.
Medicine,
Medicines.
actual.
Opo, walang
No
involved
cash
na
outlay.
pera po dito.
Walang cash
Because
outlay.
yung fund natin ng PhilHealth, yung fund ng consulta package will be given to the local health
Clinic.
board.
Oo.
Local health board, which
Oo.
comprises of the mayors and
they will be held accountable sa mga
Yes.
tao na who will be receiving that. Hindi naman dyan outright na parang giveaway. Kasi minsan may mga gamot sa health center na minsan pumapaso na, hindi nagagamit ng mga tao. Dahil, di ba, may mga hindi nagpupunta o hindi available sa clinic. So, anyway, maiksi na, wala na tayong time. Thank you very much.
Okay.
But it has been a wonderful talagang madugo yung pinag-usapan natin at saka very fruitful ang ating discussion. And you know that this will not be the last kasi every twice a month, PhilHealth will be with us. Pero i-report nyo yung mga developments, mga naka-accredit na, lalo na yung mga clinics, at saka yung balikan natin yung availment, kung ano pwede lang ma-avail dahil hanggat hindi naiintindihan nila kung ano-ano. At saka minsan naman, miski hindi kailangan magpapatest para lang makaklaim. Mali din naman yun eh. Kung ano yung kailangan, and that should be certified na kailangan. So on that note, thank you very much. Parting words mo na, Mon?
Okay, again, maraming salamat po sa inyong Secretary Corazon, sa DZRJ, and of course sa inyong programang Serbisyo Ora-Mismo, for giving us this opportunity to inform the public, our fellow Filipinos who are the members of PhilHealth, to know more about the policies updates about the programs of the Universal Healthcare Act. Yun lang po, at stay safe po, lagi po tayong mag-ingat. Tandaan po natin na dito po ang PhilHealth, pero hindi po ayaw naman po natin na magamit niyo yung PhilHealth, kasi kung nagamit yung PhilHealth, ang ibig sabihin nagkasakit o na-aksidente tayo. Pero pag yung nagamit niyo yung consulta package, mas maganda po yan, at least siguradong nasusustain natin yung ating kalusugan. Yan lamang po, at magandang hapon po, and have a
good weekend.
Fruitful weekend po, this one. Thank you po. Maraming salamat.
Ako naman, thank you very much, Mon, for finding the time. Alam mo, time is precious para dito sa ating pinatinalakay. Naniniwala ako, magagawa natin talaga ang lahat ng bagay, hindi tayo nag-iisa. And I think dapat talagang kapartner natin dito ang barangay, kapartner natin dito ang local health system, and we must improve the health system in the country because PhilHealth is your partner in health. Maraming salamat.
Salamat po.